Hey everybody, it's Dr. Eric Balkavich. We're back for another edition of Thyroid Answers podcast. We have another guest today. Her name is Whitney Morgan. She is an acupuncturist and a functional medicine practitioner. And we're just going to get into a discussion about really kind of the introductory pieces maybe to functional medicine and the benefits of sometimes working with functional medicine coach or one-on-one with a practitioner. But she has some knowledge that she can bring to the discussion today. And we'll probably maybe get into a little bit about something that everybody talks about, but maybe we need to go back and have another discussion on, and that's this conversation about gluten sensitivity and why it might be good to get eliminated, why everybody may not need to get rid of it, why maybe it's beneficial for some people, and maybe talk about, can you ever bring it back? Should you ever bring it back? We'll kind of get into that. So Whitney, thanks for joining us on the Thyroid Answers podcast. How are you doing today?
I'm doing great, and I'm excited to be here, and I appreciate you having me.
Awesome. So I guess the best place to start is to have you kind of tell the listeners a little bit about your background, because as an acupuncturist, people might not think of an acupuncturist as somebody who's maybe practicing functional medicine, but this is a big part of your practice and what you do. So how did you get into acupuncture, and then how did you get into functional medicine?
Yeah, well, I think like so many people in this space, it was my own personal health journey that kind of led me down this route. Um, I grew up in a traditional medical household where surrounded by doctors and surgeons and whatnot. So in my reality, conventional medicine was the place to be. And in 1996, I got my first autoimmune diagnosis and went that route, specialist after specialist. I became what I call an autoimmune collector. And it wasn't until my third autoimmune diagnosis, which was interstitial cystitis, that I kind of got off the path of conventional medicine because the prognosis was a little too doom and gloom for me, and I couldn't accept it. I didn't know what I needed, but I knew I needed something different. At that time, and there wasn't the whole functional medicine wasn't part of the zeitgeist. And, I didn't know where to go. I did find a fantastic naturopathic physician who is still my number one partner for my health today. But I also started getting acupuncture for the first time, and it was the only thing that eliminated my pain. And for those listeners who don't know, interstitial cystitis is excruciatingly painful 24/7. It's like the worst urinary tract infection you could have, and it never goes away. And that even hardcore pain meds, it didn't really touch it. So to have an experience where this magic of acupuncture, I walked out of there pain free. I just kept going back, and then I fell in love with the medicine. And I tend to be a bit. When I fall in love with something, when I get passionate about it, I just want to jump into it. So not only did I want to receive the medicine, but I wanted to learn everything I could about it. So I decided to go to school. And what I didn't know then, but I kind of see it now, is that, like with Ayurvedic medicine, Chinese medicine is functional medicine. It is this ancient functional medicine, root cause medicine. It's very elegant. Different language, a different way of expressing what's going on with the body, but really trying to get at the same fundamental principles. And as I was learning everything in acupuncture school and applying it to myself, I was getting better, and everything was reverse engineering for me. And the things that traditional medicine was telling me weren't possible were happening for me. So when I became an acupuncturist, I decided, okay, now I really wanted to balance that out with more of a Western version of that. So, and it was perfect at that time. I found functional diagnostic nutrition. I got certified, and then I did some additional functional medicine training after that. And for me, it felt like, oh, now I'm balanced. I have the best of kind of this modern, ancient East and West, which was very satisfying for me as as a clinician, and I think ultimately allows me to bring a little bit more to the table for my clients. But here I am today, and all of my autoimmune diseases, celiac being the fourth and final diagnosis I received, all of them are in remission, and I'm happy to be pain-free, symptom-free. And now I just love what I do, helping other people kind of walk that same path, but hopefully not take 15 years to do it.
Yeah. Well, sometimes you gotta go through it to get
That-
over it, right?
That's right. That's right.
So let me ask you this question because I think there's a lot of different opinions about this.
Mhm.
Is that one of the things we hear is that you'll hear people say what you have is an autoimmune condition. Your immune system is out of control and it's attacking your body. What are your thoughts on that as concept of what's wrong? Do you agree with that statement or do you have a different thought process?
I would say it's a very rudimentary and fatalistic way of describing something. Um, I would say it's more kind of the language you use, that adaptive response.
Mhm.
It, it's it's not the problem. It's the body trying to self-correct for a cascade of dominoes that came before,
Mhm.
that have created this tipping point, right? This critical event. And so, yeah, now all bets are off. And um, I think the tendency is to focus on the autoimmune process, the location, the diagnosis. Like, yeah, but that's not really the problem in my head. My head is like, okay, I want to know about all those dominoes that came before. What's your perfect storm? What's your cascade? Where did it start? And so I think that's why it's really important to well, one, you have a very thorough intake. You need to know the history, the timeline, everything that's unique for that person, right?
Mhm.
Because my Hashimoto's diagnosis or my interstitial diagnosis might be the same as yours, but how we got there is different,
Mhm.
and how we're going to get out and reverse engineer this is
Mhm.
different. So but I certainly value the conventional approach when it's necessary and it alleviates suffering in the moment. But we need both. We need to be able to alleviate that suffering and to kind of start digging and solve the mystery and unraveling the problem so that the body can get to a place where, okay, now it can do what it knows what to do, which is maintain homeostasis.
Yeah, I think one of the things you said was the fatalistic approach. And
Mhm.
my issue with how it gets classified, and you can agree or disagree, is that when we tell somebody that your immune system is out of control and is attacking you, well, then does seem fatalistic, right? It does
Yes,
sound like there's no way, there's no hope because my immune
that's right.
system no longer identifies my thyroid as self. It doesn't identify my issues, whatever the
Yes.
autoimmune condition, as self, and I'm doomed. And now the only
Yep.
solution is to manage it
Yep.
and suppress the immune system. And I think that's a backwards way of thinking, and it's not good for a patient's mental well-being, which is key to getting well. Is you have to have good headspace to get well. And so, what I like to people to understand is that if you have an immune-driven condition, my perception is your immune system hasn't technically lost control. Your immune
Mhm.
system is getting signals that there's danger, there's a threat, and the immune
That's
system
right.
is trying to identify and address whatever that threat response is,
Mhm.
whatever's driving that threat response. And the good news for the people who are listening is what that means is if you can address and identify the things that are activating this stress response and this danger physiology, if you can address them, reduce them, or eliminate those factors, you can then support the recovery back to normal physiology. And you can see your immune conditions, however you want to say it, resolve, go into
Mhm.
remission, whatever. And some people say, well, you can't ever get rid of an immune condition. Well,
Yes, you can.
you can, you can.
Yes, you
That's
can.
right.
I am
Because,
proof of that. Yeah.
right. Listen, I have lots of clients that are
Yeah.
proof of that, and I'm proof of that myself. I
Yeah.
mean, at one point I was collecting my own immune-driven disorders, right? Raynaud's and Hashimoto's, and
Mhm.
it's been years since I've had a Raynaud's episode.
Yeah.
I don't have thyroid antibodies any longer, right? My thyroid physiology
Exactly.
is fine. So if
Exactly.
you can't recover from it, then what the heck is going on with all my clients? What's going on with me? It
Mhm.
must be something that's manageable. And I think that's an important place for all of us to be, is that anybody can develop an immune driven disorder. Anybody. And the likelihood is that if you address the root issues, there's a good chance and a good probability that your immune system can calm back down again. There's less
Absolutely.
damage and destruction, and you can recover. And so I always try and get people to flip the discussion from your body's attacking you, to your body's trying to protect you from something. We need to uncover what
Absolutely.
your body's trying to protect you from. And if we can do that, you're going to be fine in time.
Yes. And I agree with you 100%. I think the body is always in the process of trying to protect us, save us, increase our survival rate, right? It's always doing what it feels is in our best interest. And I my critical moment when I was sitting in my urologist's office and getting this nocebo message of this isn't going to kill you, but you'll die with it. And it's going to get worse. We'll try and manage the pain. Nothing can be done. Join a support group. I mean, that was my message. And I literally heard every cell in my body just like scream no. It was just no. I can't accept this. But that type of message is almost dissociative, right? It's not just saying your body's attacking you or you're doomed. It's also putting the human spirit in a place where now they are dissociating from their body because their body is the enemy,
Hmm.
right? It's a cognitive dissonance that is so contrary to healing. It's almost becomes a self-fulfilling prophecy then, right?
Hmm.
If you accept that paradigm,
Yeah.
well, then the doctor's right. You're going to
Hmm.
walk down that path because you're not going to know any different. Um, but yeah, I think that's mindset is key. And in Chinese medicine, um, one of the fundamental premises is that it is the mental emotional state that is the source of all endogenous illness, right? Illness either comes from the environment, some invasion, or it comes from an internal imbalance. And the primary starting point is emotion and mental emotional energy. And
Yeah.
matter follows energy. That is the law. So if we can shift our energy, we can shift our matter. And one of the easiest ways to shift energy is with our thoughts, our emotions, our beliefs, our breath, right? I mean, that's where the real magic is. All the other stuff we do, the testing and the supplements and the this and that, that's great. But if you don't have that primal pulse of shifting the energy, it's going to be a much harder road.
Yeah. Mindset plays a huge role. I mean, one of my early mentors was a guy named Bruce Lipton, and
Oh yeah.
Bru- and he wrote The Biology of Belief, and
Yep.
I was in chiropractic school when I met Bruce, and I was like, really? Like our thoughts, our feelings, our emotions can change our behavior. And it was I came from a medical background, so that
Mhm.
would kind of be like silly talk, that if
Right.
that could have, that your mind could make a change. But we see that some of the ancient practices they've known this for centuries, right? They work
Mhm.
on breath work and they work on mindset and shifting and breathing and all these things. Before there was a lot of medicines, somehow they
That's
were
right.
able to stay healthy and stay well without all the supplementation, without all the fancy testing, by just living, thinking, breathing, and moving better, right?
That's right. That's right.
And I think a big downside to what's happening in today's world is we don't think well,
Right.
right? We spend more time listening or watching other people's fake lives on social media and thinking we're missing out on something. We
Mhm.
spend more time with the noise of TV and what goes on in movies and TV that kind of indoctrinate us to things that are going on. We spend very little time moving well. We spend very little time thinking well. And we
Mhm.
wind up really focused on problems versus solutions. And we're spending so much time in the very habits and behaviors that created our illness that there's no way with the same habits, behaviors, mindset um, that created our illness that we can ever you can't that that you won't recover. And then we're taught to some degree that what's wrong with us is the disease, when reality the disease is what developed from these habits, these behaviors, and what's going on in our environment. Would you kind of agree with that?
Absolutely.
Yeah.
100%. And it's a vicious cycle at a certain point because um that over identification with a disease as if you are the disease, right?
Mm.
I am this, I have this. Um that then becomes a driving force in the repetitive ways that we think and feel and believe, which perpetuate, right? So again, coming back to Chinese medicine, every organ has a specific frequency, right? Liver qi is different than heart qi, is different than spleen qi, and it is a symphony, it is a dance, it is, and there is no way, even as an acupuncturist or an herbalist, that I can actually be better at manipulating all those different types of qi than your body has the wisdom that I could never obtain, right, as a practitioner. Um, but it's if we if we have repetitive low frequency thinking and believing and thoughts, that affects the frequency of every cell. So the cells that make up your liver, the cells that make up your spleen, they're supposed to have a certain frequency of chi. All of your thoughts will impact that, right? So if you're down regulating all of your chi, right, then matter down regulates
Mm.
because matter follows energy.
So somebody's thinking about this, like, what are you talking about? She, what the heck, what is that? Like, so some people
Yeah,
don't know. So why don't you kind of get into a little bit of what you mean by the somebody's chi?
sure. Well, I guess the easiest way to put it is it is life force, right? It
Mhm.
is the energy that allows your heart to pump, your blood to flow, the fluids in your body to flow. That it allows the energy that drives every cell that we would call ATP or whatever, right? I mean, it is the that primal spark. Um, and we have highways through our body, just like we have a circulatory system, we have a meridian system where these different types of chi flow and maintain balance. And when chi stagnates, well, blood stagnates and fluid stagnates, and we have inflammation and we have pain um, and even the things that we do emotionally um, will, if we're angry, that will cause liver chi stagnation. So, monitoring your emotions is really important. But chi is just it's part of our body. It's not some woo woo magical thing. It is true. We are energy. We are made of energy, and if we did not have this energy in our body, we would not be able to animate matter, right? We would all just be like inanimate objects.
Yeah, I
S-
think for the listener, like we talk about, there's an intelligence and energy and a
Mhm.
communication in the body, and even though we can't see it, we can't smell it, we can't taste it, specifically, like there's, it's not like, oh yeah, now I can see this energy moving through my hand.
Right.
The live body and the dead body are exactly the same, except for one thing. That vital energy, the
That's right.
communication force is different. So I think we use different names to try and explain it. I don't think we have the best scientific explanation for what it is, but it's an energy, it's an intelligence that's within us. And that energy and intelligence is able to do all this amazing stuff on an ongoing basis in your body without you ever really thinking about it. How does
That's
your heart know how to pump blood? How does your
that's
brain know
right.
when to release hormones? So
That's right.
it's this, I think, if it's important to understand that, because there's a lot of things that influence how that energy, how that vital force works, and we can do things that positively influence that through our
Yes.
habits, our behaviors, our diet, our nutrition, our environmental exposures, or we can do things that negatively impact it. And if we
Yes.
do more things that negatively impact it on a chronic, ongoing basis, that can start to, over time, create adaptive changes. It can create more of a stress response in the physiology that then results in downregulation of certain systems,
Hmm.
dysfunction, then malfunction, and then ultimately disease and death. But
Yeah.
we often wait to do anything about it until we see the overt disease status, the pathology, and then we think the condition has started, when in reality, the condition has been
Started a
developing
long
for,
time ago.
right.
Yes, that is true. And I just want to point out too that chi is something you can feel. And you can develop your own sensory ability to manage and feel chi flow in your body. Practices like qigong and tai chi can help you do this. And when you practice those things, that is almost like giving yourself the most comprehensive acupuncture treatment you could ever give yourself. You do that every day, you really are kind of clearing all of the energetic debris, and you are building chi where it needs to be built, you're dispersing it where it needs to be dispersed, you're balancing it. And even when I'm in the clinic, particularly at certain acupuncture points, I can feel it when I rub my finger across. I know exactly where that is because, those points are not precisely in the same place on every single person. Some people that there's a little variation. And particularly when there's a lot of deficiency and there's a lot of stagnation, an acupuncturist that's used to that level of palpation will oftentimes get that sense. They'll get the sense when they roll over the point. And then they also can get it when the needle goes in and really connects with a large amount of chi. You'll get that little zip, in your fingers. But it comes after practicing for quite some time. It's not an immediate thing. It's almost like, everybody has this ability, but unless you really open yourself up to it and allow to be tuned into that, it's really hard to develop. We miss it because we're not
Yeah,
looking for it.
yeah. I don't think we're not aware, we don't pay attention. So
Hmm.
I think that's a key point. The average person who doesn't practice those things wouldn't be aware. Like, as my early training as a chiropractor, when you're palpating people's spines and working their soft tissue all the time, I mean, you become extremely adept at
Yes.
what you perceive, at what you can perceive. But the average person isn't getting that, right? You see
Mhm.
somebody say, well, what's breathing do? I breathe. That doesn't really have an impact. But when you train breathing and breath work, you can get really good at changing your physiology. I mean, that we've known that for decades, if not
Yes.
millennia. But modern day, for people who are like, how could breathing really create change? There is a guy. I mean, Buteyko did a lot of work on how breath work can change a lot of the physiology. Wim Hof is kind of the one of the people today who's got a lot of following, not in that he can show how just changing the breath work, he can change blood pressure and
Hmm.
blood flow to a specific, I want it to go to my finger, I want it to go here, I want it to go there. And I think people are like, oh my gosh, how does he do it? Like these some crazy magic power. But really, what he's
Yeah.
done is he's trained his physiology through lots and lots of practice. Unfortunately, the average person doesn't really spend that time really getting in tune with their overall physiology. We spend more time with our external physiology, what's our external
Right.
environment, and less time working on the internal environment. So,
Yep.
good. Let's move to, since this is a Thyroid Answers podcast, and you kind of think you're kind of you're a thyroid coach or a
Hmm.
Hashimoto's coach. Even though this is the Thyroid Answers podcast, we do talk about a lot of things, thyroid physiology, and I talk through that lens. There's a lot of different opinions in functional medicine about what's going on from a thyroid perspective, and I think it goes to um, there's some different thought processes about when somebody is diagnosed as hypothyroid, they have
Hmm.
Hashimoto's, that the that this is going to be a lifelong condition for which they're going to need medication because the thyroid gland can't regenerate, it can't recover, right?
Right.
You'll hear this from a lot from traditional allopathic medicine, and I'm not anti-allopathic medicine, but people are they're like, well, my doctor only runs TSH and free T4, doesn't want to run anything
Right.
else.
Right.
And the thought process, why doesn't he do all this other things? Well, most of that training is that the immune system is damaging the gland, and it's going to continue to damage the gland, and you're going to need thyroid medication for the rest of your life. That's the general thought process and the general training.
Right. And probably more and more medication the longer you live.
Right.
Yeah.
So when somebody comes in to see you,
Hmm.
there's a couple big things. This happens to me all the time, so I want to get your take on this. Somebody comes to me and they say, "Listen, I've been diagnosed with hypothyroidism. Maybe it's Hashimoto's, maybe it's not Hashimoto's." Um, my opinion, from almost everybody, it's Hashimoto's, regardless if you have antibodies or not. Um,
Yep.
but what they really want, because they don't feel well on the medication, a lot of times is people want to know, what's the right medication? Do I need T4? Do I need T4 and T3? Do I need just T3? Because I don't feel well with what I'm needing.
Yeah.
You feel when your clients come in and they ask you, what do I need to do to fix my thyroid physiology? Is your initial thought process with that person, I've got to I got to manipulate the doses to get the blood levels right? Or are you looking at it from a different standpoint of, I need to identify what's causing this condition? Let's start with there. Let's start with that point, and then I'll go to part two.
Sure.
Is your initial focus on how do we just keep manipulating blood values with medication to try and make the person feel good? Or is it, let's try and identify why this occurred in the first place?
Yeah. Well, for starters, I just want to be really clear that manipulating dosages to get the right blood values, that is out of the scope of my practice. I would never do that, right? I mean, that's the realm of the prescribing physician. That is not my gig. Hands off. What I'm concerned about initially when I hear yes, I'm on medication is okay. What are you on? Right?
Mhm.
Is it T4 only? And if it is it Synthroid? Is it Levo? Is it, and what's the formulation? What's in it? Is there corn in it? Is there gluten? Because sometimes when you don't feel good, when people say I feel crappy and I start taking this medication, well, yeah, it could be that you're on T4 and you actually need a little bit of T3. You're a poor converter. You got gut dysfunction and liver dysfunction and blah, blah, blah. So you're not converting. But it also could be that there's corn. You're taking corn every day. You're taking gluten every day. You're like, I mean, let's just kind of clear the decks and say, if you're going to be on medication, I'm more of the vein where I just want you to make sure that you know your options, right? And that there's more than just the pharmaceutical Synthroid and Levo and Cytomel, that there are cleaner options. There are glandulars, there's compounding options, there's pros and cons to everything, but the ultimate dosing of that is not my realm, right? I'm more of an educator in that realm. I say, if you're on medication, let's make sure that your medication is leveraged so you're getting the most out of it. But you cannot medicate your way out of root causes. It doesn't work. So even if you quote unquote need the medication right now, that's not going to do diddly squat for all of the reasons why you're in this situation in the first place. So my primary focus is always, let's find out what your dominoes are. Let's find out what your perfect storm of variables are that we need to now identify as, these are your root causes. Let's deal with those, right? There's a usual
Yeah.
line of suspects that we throw up against the wall, right? But we need to find out really who did it.
Yeah.
Yeah.
Yeah. So I think it's not unusual that somebody comes into me and says, all right, and I don't prescribe either. But part of my job is, when I'm looking at somebody's labs, is to make sure if they're taking more thyroid medication than they need, that's going to inhibit my ability to help them. Because if you take, as an example, if you're the person who doesn't feel well, your TSH is like 2.5, your T4 is like 6.8, your free T4 is let's say 1.4, and your free T3 is like 2.6. Okay.
Right.
Total T3 is maybe 80. Your doctor, your primary care physician or your endocrinologist, your medical physician is probably not looking at T3 or free T3. Most do not. They look at
Yeah.
TSH and free T4.
Yeah.
But if you came to a functional medicine practitioner or an integrated practitioner, and somebody who's looking at those numbers, they may look at those numbers and say, I need to give you more T4 to lower your TSH. And in most cases, I would argue against that.
Yeah.
Okay.
Yeah.
And so I want to make sure that we're not driving TSH too low. And so I'll make some of those recommendations like, hey, I know your TSH is 2.5, your T4 is normal, your T3 is low, your reverse T3 is high, you have higher cholesterol, you don't need more T4. More T4 in this situation that we give you is going to suppress your TSH. It's going to drop your T3 and free T3 and free T3 lower. It's not going to raise it in this situation. So I want to make sure that person is taking the least amount of thyroid hormone that they need. So I will
That they
send
need.
them back. Yeah.
Mhm.
So I want the minimal dose. The
Sure.
other thing that comes in many times is person who is seen seen a functional, seen an endocrinologist, tried the T4 thing, up and down on T4 doses, up and down. Then they found an integrative practitioner because they read a bunch of blogs about T3, and now they started T3 therapy, and they're trying to manipulate both T4 and T3 and try and manage TSH. And many times they get the hook. And I say it's like crack. They get the first hit of T3 and they're like, oh my gosh, I feel better.
Right.
And then it plateaus. And then somebody says,
Yeah.
okay, well then we'll just give you a stronger dose. And they feel better. And then they plateau. And then they get another higher dose, and they keep trying to drive it up. And again, I think that's the wrong strategy. And you may have a different opinion, but if
No, I agree.
if somebody's a poor converter, T4 to T3, and they're not going to address the root cause issues, then
Right.
sure, some T3 may be beneficial. The thyroid gland, if you're taking thyroid hormone and suppressing TSH so that the gland's not doing anything, or it's really struggled to make anything, the thyroid gland typically makes about 5 micrograms of T3 on any given day. The other 25 micrograms is made by your peripheral tissues.
That's right.
So there's a conversion issue. And if you're not converting, taking some T3 may provide some short-term benefit.
Or you could
The problem,
support conversion in other ways.
right. So the issue becomes, my issue is for the person who's not interested in addressing the root cause issues, yeah, you
Mhm.
probably should be on a combination of
Sure.
T4 and T3.
Yeah.
But if you are going to do the work to try and address it, what I find is most people, I think it's preferable for me to have that person typically on T4 only, or if they've had a thyroidectomy, maybe 5 micrograms of T3 per day. And then I want to do these other things we're going to talk about, address those root cause
Yeah.
issues. And then as we address the root cause issues, these people that are often told they're non-converters, it's not that they can't convert. It's
No.
that the cellular intelligence doesn't want to convert. That cellular energy
Right.
we were talking about before, the cells get
That's
to
right.
choose, do they convert T4 to T3 or do they deactivate that T4 to revert T3? And
Well,
what
yeah, and you just hit on something because when you're talking, and this is why I get frustrated, like you were saying, um, uh, docs are sometimes just running TSH and T4 only. Um, you know, if you're under a lot of chronic stress for a long time, and that HPA axis dysfunction has kind of gone haywire, that's going to spill over into your HPT, and you are going to have higher reverse T3. You are going to have um, more cellular resistance to free T3, right? So sometimes just supporting adrenal health, right? Getting some HPA axis support can go a long way to reducing that reverse T3 production so that your body can actually make that choice. Oh, yeah, I'm going to choose to convert to T3 now instead of reverse T3 because I'm not in this place of stress, chronic acute stress anymore, right?
right.
But then there's also, gut dysfunction and liver dysfunction, because that's what 60% of conversion, 60 to 80% of conversion. So if you've got some chronic issues going on in the liver and in the gut, which come on, a lot, most people do, you're going to have that impaired conversion as well. So when you clean up these areas, conversion tends to take care of itself. Support the adrenals. Let's reduce your stress. Let's get good sleep. Let's clean up the diet. Let's reduce inflammation. These things start to take care of themselves, right? Let's get rid of the dysbiosis, right? Let's get rid of the cholestasis, the liver stagnation, and let's let the body optimize what it can do.
Yeah. And I think one of the things that's important too, and I know you said this is, it's one of the things I was taught in training too, is that most of the T3 um, is made by the liver and the GI tract. And now we know, and I just um, Dr. Bianco on my podcast not too long ago. I'm sure if we released that one, but what we know through his work and the work of a lot of other people is we really don't make as much T3 at the liver as we thought we did. We
Hmm,
we thought DI we thought deiodinase 1 at the
right.
liver made a lot of it, and we now know that it's about 5 micrograms is what we believe is now made from the thyroid gland via deiodinase 1. Uh, Maybe another 5 micrograms from the kidneys, and the rest of the T3 is made by all the other cells. Most of that T3 is not made by deiodinase 1 at the liver. Most of it is made in all the other tissues that have deiodinase 2. That's the big driver of conversion. So that's the big important part. And that's why too much T4 in somebody's system is not beneficial, because if you have
Mm-hmm.
too much T4 in circulation, it actually results in the ubiquination of deiodinase 2. Essentially, for the listener, what that means is T4 comes into the cell, deiodinase 2 is the enzyme that converts it to T3. But if there's a lot of T4 in circulation, that enzyme gets turned off inside those cells because the signaling from outside the cell is saying, hey, we're hyperthyroid. We have way too much T4 here. And so there's
Downregulate.
yeah, so it
Yeah.
down regulates it. So
Yeah.
one of the ways, to get more T4 to T3 conversion isn't to give more T4,
It's to reduce it.
it's to reduce it. And so that's important. And then the other
Super
piece
interesting.
is we think about deiodinase 1 as this big converter, but the literature now says that really deiodinase 1's primary job is not to make T4 into T3. It really only does it as a primary mechanism when there's too much T4 in the system. Its primary role is the breakdown of metabolization of reverse T3, which is
Super
interesting.
important.
Right.
Yeah.
So if we have in a hypothyroid state, you're going to have less metabolism of that reverse T3. So that's one of the reasons that can get built up. Not only do we have the deactivation and increased reverse T3, but we have less D1 activation or metabolism of it. So that's an interesting point, because I think we see sometimes in this space, in our space, allopathic medicine says reverse T3 does nothing. In our space,
Right.
we hear a lot of people say it blocks T3 from binding to receptors, which hasn't really been documented in the science at all, that that's actually what happens. And it's likely that if it does, it happens in such a small level that it's not really a factor. What really blocks T3 from binding to receptors is deiodinase 3, which then deactivates T3 and breaks it down. So the
So you're
reverse
talking about the
T3
concept of reverse T3 and T3 competing for the same cell receptors.
doesn't really happen.
Got it.
And when we
Got
and
it.
when we say it's mirror image, you'll hear that said in our space too, that these are mirror images of each other. They're not mirror images of each other. If you look at where the iodines are pulled off, they're two different things. They're not mirror images. So, and the reason that's important, especially for the listener, sometimes people will start pounding somebody. They'll say the reason you have your hypothyroid is because you have high reverse T3 and it's blocking the receptors. The reverse T3 is not blocking the receptors. And so people will just start pushing a lot of T3 on them, trying to drive down reverse T3. Well,
Reverse T3.
if you take a lot of T3, you'll make less T4, and
Sure.
therefore there's lower reverse T3. But as they take more and more T3, they still have the same problems, because the same stressors, the same factors that were causing the T4 to be deactivated to reverse T3 are still deactivating the T3 to T2, one of the four forms of T2, but we're not measuring T2. And so we can
No.
still wind up with the same symptomatology, and we can have mixed symptoms of hypo and hyper as well.
So
So
would you agree that, I mean, when you work with people and you see,
mhm,
if you're looking at a lab result and you see reverse T3 is really high in
yeah,
somebody, um, are you coming from a place of well, let's work at those diet and lifestyle stressors that are putting you in the position where your reverse T3 is driving up? I mean, you're still looking at doing things like, hey, let's get you some sleep, let's work on stress management. And
all of
I mean,
that
because
stuff.
I find that that's like the primary way to deal with reverse T3 is we need to change behaviors. We need to change those things that actually are the easiest things for us to control,
Yeah, and that's the
right?
most important thing. It's not sexy, right?
No, it's
It's
not.
it's it's not sexy. Most people don't want to do those things. Most people think they do I don't have anything that should be causing it, right? It must be an
Mhm.
external thing, not an internal thing. Um, but I think we have, as functional medicine practitioners, have to look at reverse T3 as a sign, but not
Yeah.
the problem,
Yeah.
right? That we look at low T3 as that there's a problem for that cells are, if we believe in the intelligence
Hmm.
of the physiology, what's happening then, if not broken, it's an adaptive change. So when we see
Sure.
low T3, high reverse T3, we then need to say, why is this occurring? Not let me manipulate it, but let me address some of those issues.
Hmm.
And those things are diet and lifestyle issues, the things that
Yes.
most people don't want to jump into.
Yeah. Yeah.
We
Yeah.
want to
Yeah.
do the fancy tasks, and the fancy tasks are nice, but it's all the other things that we need to do. And we have to, like,
Yeah.
I think the famous philosopher Donkey once said to Shrek, ogres are like onions. You have to pull back the layers,
Yeah,
right?
yeah, yeah,
But that's the same way we are. That's why that health
yeah.
history, the health timeline are so important when somebody comes in and says, I need you to fix my thyroid. Well, the thyroid's probably doing what the immune system and the thyroid physiology is probably doing what's supposed to do. And what we need to do is find out why it's forcing the physiology to do what it's doing
Right. It's behaving appropriately for it with the
for the given situation.
circumstances.
Yeah.
You're right, right, right. Um, and all those functional labs that everyone likes to run. I mean, I run them. I
Mhm.
like functional labs. Absolutely. I'm all about the data, but still it's not like there's a magic pill at the end of that data. There's no magic supplement. It still comes back to the core things of,
Mhm.
okay, well, yeah, this showed up in your functional lab work, which means you need to go to bed by 10 p.m. You need to get 8 hours of sleep. You need to stop binging Netflix until 2 a.m. You need to, right? I mean, there are some things you have to change
Yeah.
your
Oh,
life.
yeah.
And that's hard.
I had I had a new patient consult today, and we ran a comprehensive panel. This is a person who's um, on thyroid hormone medication. Her cholesterol's high, her blood pressure's
Mhm.
high, and she doesn't want to take the blood pressure medication or the thyroid. She's taking the thyroid medication, but she doesn't want to take the statin or the blood pressure medication. And so I said, what's the primary goal that you want to achieve today so that you feel like you get value for this appointment? It's the first time we've met. And she said, I want you to look at my blood work and tell me what I need to do to fix it.
Mm.
And I'm like, okay. So you have, you have, even though you have thyroiditis and you have hypothyroidism and you're taking medication, you're under converting that T4 to T3. That's a cellular thing. Now your body is doing that for a reason. Now we need to identify the reasons. But the next thing I'll always do in the lab after I looked at that panel is say, is there inflammation on my blood chemistry panel that might help me understand why the body would do that?
Yeah,
Okay. And typically everybody thinks inflammation is bad, but inflammation is the defensive mechanism. We don't
sure.
want it excessive, but if there's markers of inflammation, and depending on what that marker is, it can give us clues as to where some of that inflammation may be coming from. And then what we want to do is look at those systems and say, okay, is this tissue hypothyroidism impacting blood sugar regulation? Yeah.
Yeah.
Fasting glucose is higher, insulin's higher,
Insulin's
hemoglobin
higher.
A1C is
Yep.
higher, right? You're starting to develop a fatty liver, so it's
Yep.
affecting your blood sugar regulation. Is it affecting your lipids? Sure.
Yeah.
Cholesterol is elevated, LDL is elevated, HDL is low. Is it your triglycerides are elevated, VLDL is elevated, so it's affecting your cholesterol and your lipids, and it's creating dyslipidemia. And we can go through all the systems that are then impacted by it. And so we walked through all that stuff, and I said, so she said, okay, that's all good. What can I take to fix it? I was like, said, there isn't a thing to take. What we need to do to fix it is we need to look at your diet, your
Mhm.
lifestyle. We need to take a look at your sleep habits and behaviors. We need to look at your respiratory fitness. And then we got to we know here's your metabolic fitness. Now we got to start looking at the individual systems to how we can support them. So we need to reduce or eliminate the stressors so that the danger physiology goes away. Then we'll start to see
Yeah.
improved T4 to T3 conversion. We'll see improved absorption probably of your thyroid medication, which is one of the first problems people run into when we start working on their gut is now they're over medicated because they're absorbing more of their medication. And I'm like, there's isn't a thing, but that's more of the allopathic philosophy, which
Yeah.
is just give me the thing that'll fix it. I don't want to take a drug, but I need to give me a supplement that'll
Give me
fix it
another
instead.
thing.
Right.
Yeah. Yeah.
And
Give me a supplement.
that's
Yes.
the problem. And
Yes.
we as functional medicine practitioners have to continue to do a better job of educating ourselves and our
Yeah.
clients that we shouldn't greenwash medicine. Medicine is great because they can do this acute care and crisis care and disease management. But what functional medicine shouldn't be is exchanging 5 medications for 30 supplements.
That's right.
You still haven't addressed the root issue.
And that's a real common problem. I see that I'm a clinical advisor for FDN. So I spend, a few hours every week helping other FDN practitioners look at their labs and develop protocols. And almost, I'd say 85, 90% of the time, the first thing that the practitioner wants to know is, what's the supplement protocol? It's
Yeah.
like, no, 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 no. You can't supplement your way out of this stuff. You have to deal with the diet and the lifestyle, and that includes exercise and sleep and nervous system management, right? You have to be able to coach your clients with those things first. And then, yeah, you can optimize, a little icing on the cake, maybe a few supplements, but supplements should not be your first go-to as a practitioner. That it's the same mindset, like you're saying, that is that allopathic mindset. You're just trading one thing for the other.
Yeah.
And
And
it's
so,
more expensive,
yeah. And so for
right?
the listener, it would be nice if we could just give you the magic supplement to do it. And but you can use this, supplements should be used strategically along with
Yes.
diet and lifestyle modification and building up those things I talk about in the book and on the podcast, what I call fitness factors: your breathing, your respiration, your mindset, all these things. You have to
Hmm.
raise the level of health and fitness in those categories and then use supplements strategically to
Yeah.
improve it.
Yeah.
You'll One of the traps in functional medicine is it's great to learn a protocol. As we go to school, we learn a protocol. Here's a gut protocol. Here's a thyroid, here's a
Yes.
detox protocol. But as we become more astute practitioners, I think what most of us learn later is there isn't a gut protocol. There isn't a liver detox protocol. What there is we understand, we look at your chemistry, we listen to your signs and symptoms, we look at your labs and say, okay, based on what I see here, this is the pattern of problem. Here's I'm going to use this supplement strategically, not a protocol per se, but I'm going to use supplements to help make some changes. But I don't have a gut protocol because I don't know what's your gut issue,
Exactly. Yeah.
right? So
Yeah. Yeah.
there isn't a standard protocol, which I think is sometimes the trap. They come in, well, what's your gut? Because they've been to another practitioner before. I did a detox protocol. I did a gut
Mhm.
protocol. Well, if you just took somebody's packaged gut program, like here's my 6 supplements that you do for, and that fixes everybody's gut. That's nonsense. It
It's
might
total
work,
nonsense.
but it may not be what's right for
Right.
you, right?
Right.
So that's where a good practitioner, in the beginning, we all learn protocols because we don't know what the heck is going on. But as we get better and we become more astute at interpreting labs, not just reading them, then we really
Yes.
do individualized healthcare where we say, okay, look, here's why your carbon dioxide is low. Here's what we need to do to address that.
Right.
The carbon dioxide is not the problem. It's the sign of a problem. This is excessive acidosis, or based on your condition, you're a mouth breather. That's creating
Oh,
excessive off gassing,
yes.
and why are you fatigued? Do you need adrenal support? No. How about you breathe right? If you
Hmm.
breathe right, you'll get more oxygen to your tissues, and then you'll be have more oxygen in your cells, and then you can make more food energy into cell energy. You don't need adrenal support in this situation. I know you're tired. Somebody's told you you have adrenal fatigue. What you have is a respiratory issue. Let's address the respiratory issue. And that's breath work and breathing exercises and nose taping and mouth taping. And now
Yes.
with no supplementation, we've actually got to the root issue.
The power of breath work is, I mean, it is unbelievable, right? I mean,
Hmm.
it is almost like that magic pill you're
Hmm.
seeking,
Hmm.
right? Um, because it is that central way in which we shift the nervous system. That's, to me, that's the best way, except for perhaps acupuncture and that those kinds of things, to manage your nervous system yourself,
Hmm.
right, is through managing the breath. But yeah, I think we live in a world where people are chronic mouth breathers or shallow breathers, right? They
Hmm.
breathe too much too fast, right?
Yep.
Or they're breathing through their mouth all the time, for sure. um, but I something that coming back to practitioners and this propensity to rely on protocols and labs too, as much as I love the labs that I run, I always try and tell other practitioners, don't mistake your tools for your craft.
Mhm.
right? If you do that, you become a slave to your tools. And the tools are the labs and the
Mhm.
supplements that those are those sexy shiny object tools that
Mhm.
practitioners are busy learning about. And unfortunately, there's a lot of labs and supplement companies that are really good at marketing systems that fix everything. And here's
Mhm.
a lab that's actually going to tell us all of the products that you need that, oh, it's convenient. We actually make the products too,
Right.
right? So we'll run the lab on you and it'll fit the specific protocol and everything just looks like a wow, that solves the whole puzzle, doesn't it? But it rarely does. It's the same sort of one size fits all scenario, right?
Yeah. And no offense to any practitioner, we all start there, right? And
Yes, we
it's
do.
so helpful. It's
Yes,
so
we do.
helpful, right? It is so
Yes.
helpful when you don't know what's going on, but the longer you're in it, the less labs you have to run because you start to see the patterns. I always say the
Yeah.
blood work, you can't assess like if you gave me like here's my TSH and T4, what does this tell you? It tells me next to nothing because
Nothing.
I have nothing to compare it. Like, is it good? I don't know if it's appropriate. Well, my TSH is 1.0. That never everybody says that's optimal. Based on what? What's your T4? What's your T3? What's your free T4? What's your free T3? Do you have a blood sugar issue? Yeah.
Mhm.
Well, do you have inflammation? If you have inflammation, inflammation is going to suppress your TSH and may cause your TSH to be normal in the normal optimal range, even though you don't have appropriate T3 to run the system. So
Right.
sometimes people look at labs in a vacuum, but a good astute functional medicine practitioner is not going to look at labs in a vacuum. They're going to say,
Yeah.
all right, I need the labs. I need your signs and symptoms. I need your health history. And now I want to see what this means in the context of you and your signs and symptoms. You always have
Yeah.
to have context, right? Because in functional medicine, the context matters. We're not trying to treat a lab, we're trying to treat cause. In allopathic
Yeah.
medicine, they only have to run a couple tests because what they're trying to do is manage a lab value. Oftentimes, your blood pressure's high. I give you something to lower the blood pressure. In functional medicine, you have high blood pressure. We say, okay, there's about 15 reasons that may cause high blood pressure. Let's start working our way through those 15 things that could be driving you to have high blood pressure. And oh, by the way, the high blood pressure is because your body is saying, oh man, I need to get more blood flow and oxygen to my extremities, my brain being one of
Mhm.
them, right?
Mhm.
So we look at it as a problem and chronic, just so everybody's aware, having chronically high blood pressure is potentially dangerous. So we're not saying, well,
Yes.
you should have it, but the high blood pressure, we need to keep you safe. And maybe there's a management that needs to be done with medication, but then we can't stop there. We need to
Right.
address the root issue. And then as we do, guess what? You may not need anymore. You may not need the low
Oh,
blood pressure
particularly where
medication,
blood
right?
pressure is concerned. I just saw it with a client in the last few weeks going to her doctor and reducing her dosage almost in half because of
Mhm.
all of the nutritional and lifestyle changes that she's been making and which has resulted in her losing 25 pounds in the
Mhm.
process. And I mean, so much inflammation and stress off the system. So then but that's why you have to be closely monitored through these things
Mhm.
if you're on pharmaceutical medications, because then a high dose, what used to work for you now is too high, and that could put you in a dangerous situation, right? So we need both. We need both things, right? we,
Right.
we need that medical doctor on board, um, to be a partner
Yeah.
in
And
that
I think that's,
process.
and I think that piece is really important. You know, I know when I left more of an allopathic model to come to more chiropractic and then a functional model, I was really kind of anti allopathic medicine. Like, you know, didn't I had problems in that model. And then you're looking at what they're doing. Because once you're in that model, it seems like that's the right way to do it. And then once you leave that model and you have health problems that cause you to leave that model, you go, well, this is so obvious when once you do your functional medicine, you're like, why would they do that? But that's the training. And so
Yeah.
I was very anti, but I think we have to do what we need is not they're bad, we're good. I think that's a bad thing. There's no way
Mhm.
that situation works. And what we need to do is really do a better job building the bridge and saying, hey, look,
Yes.
allopathic medicine is really good for acute crisis care. It's great for disease management if that's what you want.
Hmm.
But if you're the person who wants to address the cause and not be on medication, and you go into your allopathic doctor and say, listen, I got high blood pressure, I'll take the blood pressure, but what do I do to really fix it? We want them to be able to say, well, I don't work on the fix
Right.
per se. I can manage it, but hey, there's a functional medicine practitioner over
Yeah.
here who's going to help you with those root causes. And in my insurance-based world, I don't have time for that, right?
That's right. That's right.
I I don't have time to do a long, intensive blood chemistry interpretation. I do a blood chemistry. My front desk looks for H's or L's. They tell me it has an H, what has an L. I go, okay, yep, cholesterol's high, drug for that. And they got about 15
Yeah.
minutes for a consultation.
That's
So
right.
what we should be doing, and I was part of the problem before, but is working with becoming part of that team. Let that medical
Yes.
doctor be part of your team. We don't want to say, hey, you're doing this wrong. We just want to say, hey, we're going to do something a little different than what you're used to doing, but we need you on the team because
Yeah.
we're going to need potentially to have these medications
We all want the
modified,
same
changed, or
thing.
adapted. Right.
We want the same thing. We want the person who feels poorly to feel better. We want them
Mhm.
to live, survive, and thrive. Okay.
Yeah.
So the doctor and the functional practitioner should totally be on the same page and respect each other's strengths, right? And what we bring
Mhm.
to the table. And I mean, I hear it from my clients, and I'm sure you hear it too. It's like, well, my doctor tells me I need to reduce my stress and I need to lose weight and I need to exercise more. And that might be the perfect advice, but that doctor only has the 10 or 15 minutes. They can't counsel the person on how to execute that
Mhm.
directive. Right.
Right.
So then they go out into their world and they're surrounded by the same people and places that affirm the person who they are, not the
Right.
person they want to become. They need someone, a functional practitioner who has coaching experience that can coach them on the execution. So,
Mhm.
hey, let's achieve your MD's directives. Yes, but let's execute it in a manner that actually we're going to be eliminating the root causes of what's going on as we do it,
Yeah.
right?
And I think if we the practitioner doesn't even have to be fully on board with how we do what we do, right?
Nope.
They just have to be open to say, hey, if there's evidence for change, then I make a dose change. So when I suggest a medication, when I send a patient back to their physician, say, hey, I think we need to lower our blood pressure. Make sure you take in your 30 days of blood
Hmm.
pressure readings so that they have justification. You've got 30 days of doing it. They can see the numbers. You tell them hey, I've been working on exercise, I'm working on my sleep, my respiration. Here's my numbers. My numbers have been really low blood pressure and I'm really tired and exhausted. And I have low
That's
energy,
right. That's
right?
right.
Because if you just go in there and say, hey, that my functional doctor wants you to drop my blood pressure, they're gonna be like, yeah, tell that guy to go pound sand. I'm
Yeah.
not changing your blood pressure, right? Because
Yeah.
in the moment that you're in that doctor's office stressed about asking him to lower your blood pressure medication, they're going
It's
to take
gonna
your
be
blood
higher.
pressure. It's going to be high. And they're like, that guy doesn't even know what he's talking about. But if
That's
we
right.
set the patient up with the right communication to go into that
Yeah.
practitioner, hey, with my functional medicine practitioner, we've been working on my diet, my lifestyle factors, and all these things, and my GI tract and my diet. And he thinks that my thyroid dose needs to be lowered, and his suggestion that we lower it. And the practitioner may say, I don't think there's a need to lower it. Then you say, look, I've lost 10 pounds, I've lost 15 pounds, my signs and symptoms are better. And I always tell patients that you're going to need to change it because at some point the medication actually becomes the problem if you're taking too
That's right.
much.
That's right.
And many times, what you want to watch for is what I call the stall. And
Mm.
so if you're seeing improvement on the same dose of medication, and then you start to see a stall in your symptoms, or you start to get more hyper type symptoms, more insomnia, more brain irritation, more brain fog, then that's usually the time to recheck the lab. So I always say, hey, listen, I suggest we lower the dose. Here's my justification for why we should do that. Go in and ask them if they'll lower the dose. And if they say they don't feel that you need to do it, just say, hey, that's my health. These are the things I'm doing. I'd like to change it. We're not doing this blindly. We're going to retest in 30 to 60 days to see where the values are. If the
Mhm.
numbers are worse, I'll go back up on the higher dose. But if they're better,
Right.
um, then we're headed in the right direction. And I usually don't get that much kickback from the practitioners because they're already seeing positive changes. Some of the patients are their worst clients anyway because they're never feel good. They're struggling. The practitioner's doing what they've been trained to do, and the person continues to complain. And so now here's the person coming in, doing better, feeling better, functioning better, and they're like, I don't know if I would, yeah, I don't know if we should reduce it, but all right, whatever you want to do.
Yeah.
And then once they see the first set of labs come back, they're like, oh, all right, good. All right, what else?
Yeah.
Now, what are we doing next? And so they
That's
start
right.
to buy into the idea, even though they may not become functional medicine practitioners, they start to go, okay, wait a minute, what are you guys? What are you guys? What are you doing? And some are like, listen, I don't care what you're doing, but you're getting
Keep
better,
doing it.
and yeah, keep doing
Yeah.
it, right? So
Yeah.
I
Yeah.
think there's benefit there.
Yeah.
So let's talk like simple strategies for the average person who's coming into, they're frustrated in allopathic medicine maybe. They get a diagnosis of hypothyroidism, and it doesn't matter if it's Hashi, not Hashi. Almost all cases for listeners, almost all
Yes.
cases of thyroiditis, the damage to the gland is driven by the immune system. Whether you see antibodies or not, it's
That's right.
immune driven.
That's right.
Most thyroiditis is Th1 dominant. There's not a lot of antibodies to begin with. And so you could have, we call it Hashimoto's because there's positive antibodies, but it's all it's thyroiditis. Okay.
Yep. Yep.
So let's say somebody's coming in. One of the challenges is you're coming from an allopathic model many times where insurance is dictating the care and paying
Yeah.
for some of what's going on. And then they come into a functional medicine space. And a lot of times this is an out of pocket expense because we don't
That's
often
right.
work in that same world. And people initially, if they haven't experienced functional medicine, they're like, why wouldn't my insurance cover it? I said, because your insurance covers the management of your disorder. It doesn't cover the time and the costs and the expertise to identify why you developed as your disorder. So
That's right.
oftentimes it's an out of a pocket expense and it's an investment. So it's a big jump. But there's a lot of things people can do
Mhm.
before they reach out to you or me.
Yeah.
So what are some of the foundational things that you talk to clients about so that they can, if they can't, let's say they can't afford a coach or they can't afford a functional medicine practitioner, what are some of the things they can do on their own? I mean, one of the things that you hear, across the board is everybody says, well, you got to be gluten free, you got to be
Yeah.
dairy free, you got to be every food free. What what are the things that you typically, from a low cost,
Mhm.
low supplementation, somebody's gets diagnosed, what are your kind of the initial things that they can do before they
Sure.
really have to invest a lot of their money to see
So,
somebody?
if someone says to me, um, I just want to do this with a diet and lifestyle, right? Want to try that first. No testing, no
Mhm.
supplements, nothing like that. Okay, that's perfect. That's a good attitude. Are you willing to give me 90 to 120 days of compliance? Okay. Um, and that's a particular type of personality, right? So if they're willing to go all in for 90 to 120 days, I would say, all right, we can't do any food testing on you. We can't do any of that. So let's just get rid of those foods that we know are inherently inflammatory and problematic for most people with inflammation, immune activation, adaptive responses, like whatever you want to call it, your diagnosis, right? Let's get rid of those things. Now that's usually gluten, dairy, soy, corn, refined sugar, alcohol. Those are like gotta go, right? Gotta go for 90 to 120 days. Um, And if you're feeling a little more adventurous, I would say, try going ancestral, try going paleo for that time frame. Get rid of the grains. Just go get rid of it, because we don't know. We don't know if rice is a problem for you. We don't know if high lectin, we just don't know these things, right? So let's try and clear the decks as best we can. Okay. So I would say go paleo or get rid of those 6 things at least. So anti-inflammatory diet. Then I want you to get to bed by 10 p.m. I suggest that you get some sort of way of monitoring your sleep. I love the Aura Ring. But hey, if you can't afford that, I would like you to be able to know, am I getting good deep sleep? Am I getting good restorative sleep? That's good data to have on yourself, right? If you can get some wearable tech that gives you some feedback, great. But you need to have good sleep hygiene. And, parents know this, right? We have kids, we can't just put them to bed. You have to start calming them down after dinner. You have to like have your bath time and your lullabies and your story and turn down the lights and cue their nervous system, right? So that they can go to sleep. We need the same thing. That doesn't change just because we're 40 instead of 4. We need to start calming our nervous system down before bed. And that means good sleep hygiene, right? When we get up in the morning, we need to set our circadian rhythm. We need to get out in the sunlight and take a walk, move the body. So managing that circadian rhythm. Then I ask people, give me 15 minutes 3 times a day where you're going to practice with actual stress management tools, whether it's breath work or tapping or meditation. I have a menu of things for people to choose from. It's like, but I want you to commit. You're going to give me these pockets of time in your day, right? And then the other thing is movement, because actually a lot of folks, particularly in the thyroid space, with women in particular, because one of their primary complaints is weight gain, they tend to be over exercising and undernourishing, right?
Hmm.
So I want to see how much you're exercising. I want to make sure that you're moving appropriately, but you're not overdoing it for the level of function that you have right now. So I'm more of a microdose your movement kind of a gal. I'd like for you to move appropriately, break up long periods of sitting for sure. Don't sit more than an hour or 90 minutes max. Get up and move in a way that actually infuses your body with joy. If that's dancing, put on some music and dance. Whatever you do that feels good to your body, right? So it's always nutrition, sleep, movement, stress reduction. Those are like the 4 things. And I want to kind of know, what is your journey throughout the day? We're going to plan the day. You're going to have kind of like a basic itinerary to follow, right? Follow that for 90 days. Just repeat it, repeat it, repeat it. Then come back to me and let's talk. And usually symptoms just start to like, you know, they start to disappear. Energy gets better. Um, Mood and outlook get better, right? Joint pain goes away. Libido takes a little, bump. And I mean, and weight starts to come off. I mean, big changes, well, little changes turn into big changes,
Hmm.
right? So it's all about the nutrition and lifestyle.
Yeah. So I think those things are key. And those are key things, concepts. I would agree on all of those. And I talk about them in the thyroid debacle. Like we have this confusion about, oh, there's a thyroid diet, there's an adrenal diet. Listen, all of the dietary stuff that everybody is making up, and essentially that is what it's made is somebody comes up with an idea, a diet maybe worked for them, or they read it somewhere, and so they name a diet, and so the
Mhm.
carnivore diet is the healthiest diet. Well,
Yeah.
maybe, right? But I think the thing, instead of trying to figure out which whole food diet is better, how about just eat whole food, right? And
Well,
focus on
there
whole
you
foods,
have
right?
that.
How
Yeah,
about
get rid of the processed foods. That
right?
that
So
goes without saying, doesn't it? I
right.
mean,
Well, I don't think so because I think in today's world,
Yeah,
we we market health foods, packaged health foods that aren't really health foods. So
that's
if
true.
somebody says, "Hey, this is keto, this is gluten free, this is whatever," but the simplest way, I think, and I agree with what you said, is sometimes to remove those things. Um, but I think the primary focus, for a lot of people to super keep it simple is eat more whole food.
I
If
would
you
agree
eat
with
more
that.
whole food, that's a
Yes.
great place to start, and it may
Yes.
not be good enough. And the biggest concern and caution I have with too much of restricted diets for people, because you see people, I've been doing this same diet for a restrictive diet for 2 years, and I keep having more and more food sensitivities, food intolerances. Sometimes you can make a lot of change, but if you're shrinking your diet for an extended periods of time and you haven't really addressed maybe permeability issues in the GI tract,
Sure.
whatever you eat and don't digest well, you might develop sensitivities to. So dietary changes, we want to use those as a tool to make change, but I think it's across the board for the vast majority of people. If we just ate more whole
Whole food.
food, right?
Yes. I would agree, though
Really.
I would not want that whole food to be whole wheat. I would not want it, right? I mean,
But you can't eat whole wheat without processing it,
I'm just, but you hear what I'm
right?
saying,
Yeah,
right? I
yeah,
mean,
yeah,
it's
yeah,
like,
yeah, yeah. Oh, yeah.
oh, well, I had this like Ezekiel sprouted bread, ancient grain. It's like, no, 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 no. I don't want you eating that because you come
Right.
to me to ask me, what can I do? I'm trying to give you the best way I know to reduce some inflammation. So,
Mhm.
yes, I agree with you. Whole foods are key. Absolutely. Just avoid certain types of things that might seem like whole foods, but they really aren't, and they're sources
Yeah.
of inflammation, right?
Yeah.
But when you talk about whole foods too, and you mentioned that the leaky gut and digestion is key, and I would also um, counsel people, you know, how we eat, how we prepare our bodies to eat is really important. Don't eat when you're stressed. Don't eat in the car. Really prepare your food mindfully. Smell the spices. Think about the food first because digestion starts in the brain.
Mm.
And then when we chew our food really well, then it continues in the mouth first. So a lot of people just think, oh, digestion happens down here. It's like, no, it starts here first. And then it
Yeah.
moves here. Then it goes here. So we need to eat in a certain way and chew our food really well. Otherwise, we're going to be more inclined to develop those food sensitivities because our food won't be broken down and our gut's going to be more leaky because we're eating when we're stressed out.
Yeah. I think that piece of too. I give those kind of you definitely have to you have to put yourself in more of a rest and digest state.
Yes.
In one of my clients, she's a mom, bunch of kids, and we talked about eating. She said, I usually eat standing because I'm cooking a bunch of different meals for everybody. So I just eat as I'm cooking. I'm like, all right, it's probably part of the problem.
Hmm.
You're stressed, you're making multiple meals for multiple kids, right? Which is problem one.
Yes.
Two, then you're eating and picking at the foods that they're not eating. And so you're doing that as you're doing stuff. You're probably gulping it down, not spending time to really chew it, put your fork down, enjoy the food, get the flavors, all that stuff. And so how about just if you feel like you have to cook your kids' food and you can't all sit down and eat together, which I would be my number one option.
Yeah.
The second option would be feed the kids and then prepare your meal and sit down and eat your
Sure.
meal,
Yeah.
right? And after 3 weeks of committing to doing that, she's like, I don't have the constipation. I don't have the gas. I don't have the bloating. I don't. I'm like,
That's right.
right, because
That's right.
you're in sympathetic mode, which really shuts down your stomach acid. It shuts down your digestive capacity. It reduces your body's ability to digest and assimilate that food. I mean, if
That's
you were
right.
being chased by a tiger, right? You're not going to be digesting food really well, right? Anytime I use
No.
this as an example for as a runner. You go to a race, and right before a big race, everybody's stresses up. Well, what's right next to the start of any race? There's like 100 porta potties. Why? because as everybody's starting to get stressed out, all the
Yeah,
stuff that they ate or drank now needs to come out, right?
that's
And
right.
so they're right. So that's their sympathetic nervous system saying, "Yo, we got to get blood flow to the tissues, the muscles.
Mhm.
We don't have it for this stuff in my GI tract. We got to empty that stuff out because I don't have time to deal with that now."
That's right.
But that's your sympathetic nervous system doing what it's supposed to do. So if you're in stress mode because I'm running around doing all these things, you're not in digest mode. And so it's simple
That's right.
strategies like that are really important and they don't cost anything, right?
They don't cost anything, and if you're in stress mode, also no repair and regeneration really takes place either, right?
Mhm.
I mean, so all the infrastructure projects that need to happen in the body, clearing away cells and repairing tissue and la 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 la, you know, those happen when we're in parasympathetic mode. And when we're in sympathetic mode, no, that's a time for survival because that's the lion chasing you,
Mhm.
right? So we if we're spending all of our time in sympathetic mode all day long and then we go to sleep, I mean that's very little time of rest and digest,
Mhm.
right? And then most people are not even getting the quantity and quality of sleep that they need, so they're not getting all of the physiological benefits, that only occur during sleep and that
Right.
can't occur when we're awake,
And then it
right?
reinforces problems because
Yes.
if you don't get quality sleep, for the listener, one of the things that's really important at night when you're sleeping, you use a ton of energy, but you're also rebuilding
Hmm.
your cellular energy molecule we call ATP. And so ATP is adenosine triphosphate. So we take food energy and convert it to cellular energy, ATP. And when we use that energy, we're pulling these phosphate groups off. And when you pull all three phosphate groups off the adenosine molecule, adenosine is your sleep hormone. That's what helps you get a good night quality sleep. It binds to receptors, it makes you tired, it helps you get a deep night's sleep. So adenosine is truly, everybody thinks it's melatonin. It's not melatonin, it's adenosine. So when you go, if you had to do it, put it a 12-hour workday outside in the cold, typically anybody who has a hard, I have a terrible night's sleep. Okay, we're going to put you outside in the cold. You're going to shovel snow. You're going to do all this stuff. How'd you sleep that night? I slept like a rock.
Of
Right.
course
Why
you
do you think
did.
you slept like a rock? Because you used up all that cellular energy. You have all this
Yeah.
adenosine. But if you don't sleep well, then you don't rebuild the adenosine back into ATP efficiently. So now you start the day with a lot of adenosine. And so you wake
Mm,
up more tired,
groggy.
more groggy because those things are bound to
Hmm.
those receptors still. So you
Hmm.
take your cup of coffee,
Hmm.
the caffeine blocks the adenosine from binding to receptors. So now I'm a little bit more alert and awake, but then still have higher levels of adenosine. So as the caffeine starts to wear off by 2 or 3 o'clock in the afternoon, you're exhausted.
That's right. I
Why?
need another
Because
cup of coffee.
right, because you have the
That's right.
adenosine buildup of
Yeah, yeah,
somebody who
yeah.
should be going to bed. And you
Hmm.
think what happens then, especially in our space, somebody says, well, you have adrenal fatigue because you're so tired. No, 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 no. What I have is probably high levels of adenosine. And so
Could
if I
be,
have
yeah.
high levels of adenosine, that's what's causing me to feel sleep. And then for the person, they say, well, I'll just take another thing of caffeine.
Hmm.
And so that caffeine kind of peps me up a little bit at 3 o'clock. So I'm not falling asleep at my desk. And it works. It does
Yeah.
work. But the problem
Yeah.
is the half-life of that caffeine is 12 hours. So
Right.
now you're ready to go to bed. You can fall asleep. But now you're having a hard time staying asleep. Why? Because the caffeine is still there, disrupting the
Right.
deep sleep, preventing you from rebuilding adenosine into ATP. So you wake up next morning even tireder.
More
And
tired.
then you get into this circle. So it's really critical that we focus on some of these kind of foundational things instead of chasing it with supplements or medications
Yeah.
sometimes to try and trick the physiology. Sometimes these foundational things that we're talking about, good breath work, good exercise, not too much but appropriate,
Yeah.
are the tools that are going to help you feel and function better. I'm tired at my desk. I'm falling asleep.
Yeah.
I need a caffeine. drink. How about you just get up and do 10 squats?
Move.
Yeah,
Yes. Yeah.
right?
Yeah. I'm a big dance fan. So I say, put on a favorite tune and just dance for 3 or 4 minutes. Okay. I mean, that's the thing about dancing. It's like the body moves in the perfect way for itself. It's not going to hurt you.
Yeah.
If you're dancing, it's not going to hurt you. Your body's not going to let you move in a way that's going to hurt you, you know? And it's a perfect little microdose.
Yeah. And that's why I recommend what I call 30-minute fitness, which
Mm,
means every
hmm
30 minutes, give me give me 30 seconds, give me a minute, right?
That's
I don't have
perfect.
time to exercise. Okay, do you have 30 seconds? Sure. If you got 30 seconds, set your watch, set
Yeah.
your iPhone for 30 minutes. Every 30 minutes, give 30 seconds of something. Dance, squat, lunge,
Yeah.
walk, do something.
And let's
Push-ups,
not call it
whatever.
exercise. Let's just call it movement. Okay. Let's
Mhm,
just, because exercise, this fitness culture, we have a preconceived notion of what that means.
mhm,
30 seconds, you're going to have a hard time convincing someone that that's exercise. No, it's movement, which is what the
mhm.
body needs. It's what it craves. Right.
Yeah.
And we absolutely have to break up the non movement because
Mhm.
that's one of,
That's been the detriment. It's a
yeah.
huge issue and
Yeah.
problem.
Yeah.
Even, these things that we're
Yes,
on and we
I
use so
know. It's
much
like, oh my
are
God, I'm sitting here for an hour and
yeah.
a half. That's
So,
right.
and if you're a person like me, and you who are at a desk, like, modify that. Like, I have a chair
Yes,
that I could sit, but I have a stand-up desk, so I've done this whole podcast on my wobble board as I'm standing here
that's
talking, right?
nice.
So
Yeah.
I'm still moving, I can still do my work, right? And then if I get tired, I put my desk down, I sit in my chair, but take time to keep moving, switching positions. And
Mhm.
if you work at a desk, I love the stand-up desk and wobble board because the wobble board, you're not static, you're not putting a lot as much tension on the joints because standing still that can be fatiguing as well. And
Definitely.
so the wobble board allows for a lot of movement mobility, take stress and strain off the tissues. It's easy to do. You're just kind of moving back and forth. It's not a, and it's super easy on the tissue, but you're up, you're moving, and it's going to be beneficial. So I know we're getting close to the end of our time,
Yeah,
but I think the last two things I want to do is we kind of talked about what people could do, maybe before hiring a health coach or a functional
mhm,
medicine practitioner to help them. But some people still, it's still more than their budget allows. I know you said you
sure.
started um, in a program or I think you called it the Functional Health Alliance, where people who
Yes.
need guidance but really can't afford um, a health functional medicine practitioner or a health coach, they might be able to go there and get some help or guidance. So can you explain that a little bit?
Yeah, it's called the Functional Health Alliance, and they can go to functionalhealthalliance.com and learn about it. My colleague Paula Reed and I developed it really specifically for people who needed our services but couldn't afford them. So we developed this space. We have a free online group, and then we also do monthly Q&A sessions, and we offer office hours that are free, so you can get little 15-minute sessions every week if you want. And we have free courses, we have really low cost courses. We try and make it a space where it's as supportive and root cause based as possible, and it's really built to save people from what they end up doing, which is googling their way into, right, some sort of a plan, right,
Mhm.
or going on Instagram and getting this influencer's little $175 magic fix or whatever. We just wanted a space where, hey, you've got a couple of coaches who are going to be here every day in this space. You can ask questions, you can come to the Q&As, you can come to office hours if you need privacy, you can message us privately, right? But we want it to be that root cause wellness hub for folks that they want to make the changes, they just can't afford the private coaching.
Right. And so you're not going to necessarily come in there with your blood work and say, "Hey, what should I be doing?" You're going to be focused on the things that we talked about today. Okay,
Correct.
here's some strategies that you can work on. Let's
Yeah.
work on diet. Let's make a plan to work on this.
Absolutely. But we do offer, like, we've got a gut wellness course, we have a thyroid course, we have a understanding your cholesterol numbers course. We give little presentations on certain concepts. So you can get these little bite-sized educational pieces that might help you understand your lab work better, might help you be a better advocate for yourself when you go to your doctor's office. But yeah, we're not taking a look at your labs and analyzing them for you. It's not that kind of a space. Yeah.
Yeah, I just want to make sure because sometimes people are like, "Oh, I can get a free consult on my blood work and they'll tell me what I need to do."
No.
That's not you. That really can't be done well in a short thing. That's
Mm-mm.
and that anybody who's for the most part, and I don't want to make this sound wrong, but anybody who's going to take a 5-minute look at your blood work and tell you what you need supplementation wise is not doing functional medicine, in my
No.
opinion. They're
No.
they're that's more of an allopathic model. Oh, magnesium's low, let me give you magnesium. Oh,
Right.
that's low, let me give you this, right? What functional medicine is really about is what we've been talking about this whole podcast, which is
Yeah.
kind of the root cause issues that cause dysfunction in the body,
Yeah.
malfunction in the body. And it doesn't matter what the diagnosis is. It doesn't matter if you've been diagnosed with dyslipidemia, a
True.
thyroid problem, you have a weight issue, you have you have what you think is adrenal fatigue, whatever the issue is. I don't stay asleep at night. There's a foundational concepts or
Mhm.
reasons why that is. And what we're trying to do in functional medicine is, oh, just take this dose of melatonin that should help get you to sleep. It should be okay, here's the things that are potentially causing, here's the things that you should improve, because these are the things
Mhm.
that are probably creating it. So change these things, see how that works. And
Yeah.
if it doesn't work and you're doing those right things, then you really do need a functional medicine practitioner or a health
Yeah.
coach to help you dig in a little bit more because it may be a bit
Absolutely.
more involved.
And I think too, one thing that I want to mention before we sign off is that um, a lot of the struggle that most people have isn't really what to do um, in terms of nutrition and lifestyle. It's not the plan; it's the execution of the plan, and it's adhering to a plan when they don't feel supported by the people in their lives. I mean, the kinds of things that people come to me in those little 15-minute office hours about, it's like, oh my God, how do I deal with, my spouse or my mother, or when I go to this family dinner and I'm getting pressured for this, or people are telling me that these changes are making it so I can't socialize and take advantage and be the same in the family that I used to. It's those kinds of sort of social, mental, emotional struggles. Change is hard mentally and emotionally. It's not actually the things you have to do that are the hard things. It's doing them in the context of your life, right? And handling that kind of mental emotional relationship adjustment that must take place. That's kind of the biggest struggle that most women who come to me in small sessions are really coming for. How do I strategize this in the life that I currently live?
Yeah. And I think it's tough because
Yeah.
the feedback you get from other people who see you making these changes is not really about the changes you're making.
It's about
It's
them.
about them and how
Hmm.
it makes them feel guilty
Threatened.
or threatened or bad. Like,
Hmm.
oh, you're giving up alcohol. Like, why would you do that? Well,
That's right.
you're not eating this cake or pie, or you're not eating this this junky food. Why? Oh, what do you think you're better than me? Like, but it makes that person feel uncomfortable. Like, oh man, maybe I shouldn't be doing it, but I want to do it, right? Or I don't want to give that
Hmm.
up, right? Even though, well, I don't exercise, look at me, right? Right. And they make those, maybe those snacks, oh, you're always working out. Probably they're doing that to make themselves feel better about sometimes their poor health, their poor habits, their poor behavior. So I think it's good they have a place that they can go. But I agree with you. Some of the biggest struggle is the circle they're around
Yes.
that's trying to pull them back instead of.
Reaffirm the person they used to be,
Mhm,
right? Or the person they don't want to be anymore, which usually means reaffirming the diagnosis they have, the
right.
pathology, the disease,
Mhm.
right? So yeah, that is the hardest struggle. It really
Yeah.
is. Yeah.
And especially for even in the world where you see people now, we have this forum where people join groups of other people of
Mhm.
Hashimoto's or other people with fibromyalgia or other people with adrenal fatigue, and they join a group, which now becomes a new group of people that they can all. These are my this is my new tribe. These are all people that struggle with me, and now I'm trying to do things to get better. Man, it's a kind of an uncomfortable situation,
It can be
right?
a
Because
toxic place.
yeah,
Yeah. Yeah, yeah,
because
yeah.
everybody's
Yeah.
maybe busy complaining instead of supportive, right?
Yes.
So
Yes. Yeah.
awesome. Hey, it's been a great conversation. I think it's we I think it's an hour and a half went by really quick,
We
right?
covered a lot of ground. Yeah, we did.
So let's just finish up. Just give people an idea if they want to learn more about you, what you do, maybe the Health Alliance. Where can they find out more about you?
Sure. Well, they could go to Whitney Morgan Nutrition. That's my website. That's Instagram, Facebook, LinkedIn. It's all Whitney Morgan Nutrition. Or they can go to the Functional Health Alliance. So
Okay,
those are the two places. Pretty simple. And yeah, and I'm on YouTube.
awesome.
You can
All
find
right,
me.
Wendy. All right, Wendy, I appreciate you coming on the podcast. It was a
I
great
appreciate you
conversation.
having
We'll have
me.
to do it
Thank you.
again in the future. And I think we had a list of other topics we were going to talk about. We didn't even get to them. So we'll have to
Next
do that
time.
another time. Okay. All right.
Alrighty.
So for the listeners, thanks for tuning in. Make sure you share this podcast with friends and family. It doesn't matter what condition they're struggling with. These are all
Yeah.
foundational concepts to be healthy and to be well. That's really what we focus this on. And I think it is so important that you don't jump over these dollar bills to pick up the pennies. You're missing some of the most vital things. You're never going to get healthy and well for any extended period of time. You can do all the gut protocols you want, but if you have the same stressors, the same habits, the same behaviors that created the the terrain that allowed bacteria to overgrow or created a leaky gut, you're going to be back there in 6 months or a
That's right.
year. Doesn't matter what the protocol is. It will not matter. You have to deal with these foundational concepts. Okay. So,
Amen. Yes.
Whitney, we're going to sign off.
All
Thanks
right.
so much for coming on the podcast, and we'll get you back on sometime in the future. Okay.
Thank you so much. Good to be here.